Hi, I'm Dr. Nishant Yagnik. I'm a neurosurgeon. I operate on the brain and the spine. And I wanted to tell you today about a patient that I did this week that showed that the risk of surgery is much more than for the surgery itself. So I had this patient from Zambia who came up to me. I'm in Delhi, in India, and I had told him that his diagnosis was very complex. Now, this diagnosis is a C1, C2 dislocation. He was around 48, and he'd had an injury to the first two vertebrae, which are the bones of his spine, the ones that attach the head to the spine itself. And the spinal cord, it starts from here, right? So, and he had such severe compression on this spinal cord um, that the spinal cord that should be the size thickness of a dollar was thinned out to a pin. And the surgery is complex, but it has a 5% rate of severe complications like paralysis and being in a coma, 1% chance of death. I had mentioned this to him on an online consult 2 months before he arrived, and then when he came down, he was alone. He came down without a single attendant, no friend, no family, nothing. And I discussed this with him. And I knew, and he was absolutely gung ho about it. He was like, Doc, go ahead with it. I don't need anyone. But I knew the reality. If something goes wrong, um, the patient would have been in a coma in my hospital and no one else to take care of him but me. Uh, because, the patient has limited financial resources and this patient is now paralyzed. So I would have had to contact the embassy, but I would have essentially had to nurse him till the time he at least got to a level where he can go back to his home country, which sometimes can be never. So, despite all of that, we took the risk. He had come down, he needed the surgery absolutely. He was getting weaker and his balance was getting really bad. We took a deep breath, and myself and my team, we did the surgery. Thankfully, it all went well. You see, when nerve tissue is compressed slowly over 12 years, if you open it even slow, even over 2 to 4 hours, it re-expands, and then sometimes it can't handle the blood flow or the swelling that comes from that. This is called reperfusion injury, and even in the best surgery, this can happen despite your medications to prevent it. Thankfully, it did not happen, and I'm proud to say that this man, he's now taken off his collar and roamed around the whole of Delhi NCR, and he came back to OPD this week, and I was just so happy to see him. It just comes to show the surgical risk is there, yes, but there's a person behind that surgical risk, and that person takes great risk personally from his family to to get things right. So does the doctor.